Hi there, I'm Joanne, one of Healthwatch Calderdale's engagement and information officers. We get asked lots of questions every day by the people of Calderdale. So we thought we'd host an Ask Healthwatch event and provide some of those answers on our social media platforms, and which we can share this information in a new way. We've been asked this week how people can feedback difficulties they have when booking GP appointments. We know that health services changed the way they operated due to the pandemic, but we've been told that in some parts of Calderdale, it remains difficult for patients to book a GP appointment. This includes getting through on the phone or being able to book an appointment on the same day or week. We do work with health centres to share your feedback, but we really want to empower people to be involved. One of the pieces of advice we have given is for people to join patient forums. They are known as patient participation groups or PPGs. And these groups can act as a bridge between patients and practice managers and GPs to make a difference for all. If you don't have time to join a group, you can find out how to contact the people on it to share your own views. To find out about your PPG, ask your doctor's practice or look on their website. It is a really positive way to make a difference and understand what is happening at your practice and why. But if you do continue to struggle, you can contact your GP practice manager, or you can contact us at Healthwatch and ask for support to resolve the difficulties. Another question we've been asked this week is this. Please can you say who does social care complaints when you only do health? So that's correct. We at Healthwatch can support people to make complaints about NHS care, but social care complaints need to be shared with the service provider or the organisation that funds social care, such as the council. The best advice we give when making a complaint is to say what happened, when, who is involved, and also say what outcome you would like. It would really help focus the matter for those investigating. You can also contact the Care Quality Commission, which holds inspections of social care settings. But first, we would advise that you work with the organisation itself and give them the chance to respond. The most common question we are asked currently is, how can I find an NHS dentist? We get asked this by people wanting to register for routine care or people in urgent dental pain. If you have an urgent dental need and you are not registered anywhere, then you can call NHS 111 and ask for dental triage. You can also call any dental practice that has an NHS contract and ask for assistance that way. You should be offered advice over the telephone, an appointment if it's needed, and treatment to resolve the issue you currently face. This may not mean that you'll be taken on by the practice in future, but it should provide the care you currently need. We hear from people every week who are struggling, and we are in touch with dental practices and NHS England to explore if there is capacity anywhere. If it's not working for you, then please let us know. There is loads of information available on our website about this, and we will share the link on our social media pages today. Finally, there are some changes this week to the COVID testing and symptoms. New symptoms have been added, which include feeling sick and headaches, as well as the typical cough and high temperature symptoms. If you have symptoms and you are no longer required to do a lateral flow test or a PCR test, and you are advised to stay at home until you feel better. The testing sites are closing, and the home testing kits will no longer be sent free of charge to all who request one. If you still want to get tested and you're not eligible for a free NHS test, you must pay for a COVID test yourself. We've had a look around today and we've found some for £2 online. Your local pharmacist may also have some that you can buy, so it's worth going in to ask. Lateral flow tests will still be available for some groups, including some NHS staff and people with certain health conditions. So check out nhs.uk for more details. That's all for this edition of Ask Healthwatch. We'll be posting more vlogs in future on our social media platforms. So if there's a question you'd like us to answer or a subject you'd like us to talk about, just ask.